What are some frequently asked questions in physical therapy? This video is for the general public to give them information regarding about what to expect when it comes to PT.
People are often dealing with pain or struggling with something for a while before coming to therapy, so sometimes clearing up what to expect can be super helpful.
Question number 1 is, what happens during my first visit?
The first visit is initial evaluation, which just basically means that we get to know you. We get to know, who you are, what your goals are, what you're struggling with, your past medical history, and kind of like a comprehensive assessment or story about where you're at. And then we do an assessment. So we might look at your range of motion or see how much motion you have and with whatever you're coming in for, how much strength you have, looking at how you move, whether that's how you walk or how you bend. And we take what you've told us and what we see during our assessment, and then we use that information to create like a plan of what would be most successful for your recovery.
What do I need to bring with me?
There are 3 things that people typically bring with them. One is a form of identification, like a driver's license. The second would be like a form of payment. So if you're using your insurance, then bring your insurance cards or your cash or credit card or however you want to pay. The third thing that people typically bring is a prescription. So if their doctor gave them a referral to physical therapy or specific orders, bring that paper with you.
Next question is, how should I dress?
Definitely not a pencil skirt. Typically people wear something that's comfortable, so whether that's sweats or a t-shirt that you can move easily in and a pair of tennis shoes.
How long will each treatment session last?
It depends on what you're coming in for, but usually people are seen for about an hour.
Why are people referred to physical therapy?
People are typically referred for physical therapy because they're having a hard time doing something that they could have done previously. So maybe they're having a hard time bending or walking or reaching or participating in something. So physical therapy addresses pain. Physical therapy can address strength and motion and a lot of things that keep people from doing what they enjoy.
Who pays for the treatment session?
In most cases, insurance companies will pay for physical therapy services. Sometimes they cover the whole treatment, sometimes they pay part and you pay part, and sometimes people just pay cash for services.
Is physical therapy painful?
I wouldn't expect your pain that you came in with to get worse when you come to physical therapy. I would expect it to get better. Doesn't mean that you're not going to have a bad day once in a while, and it doesn't mean you might not be sore from physical therapy, but ultimately you should be feeling better when you leave, not worse.
Is my physical therapist licensed?
Yes, physical therapists have to be licensed. Your physical therapist and physical therapist assistants both have licenses. There are other people that work in physical therapy clinics that do not have license, so you can always ask so you know who the licensed professionals are.
Can I go directly to my physical therapist?
Yes, you can. All of the 50 states have some form of direct access, which means you can see a physical therapist directly, but each state has different rules. So some states require that you check in with your doctor at certain points in your recovery.
What do I do after physical therapy?
Physical therapy can be like a long-term solution for a problem, and so continuing on with the things that we've taught you in therapy, whether it's better quality movement or an exercise program or something specific to keep you going and keep you feeling great, but don't be afraid to stop back in and ask questions or follow up if you're having trouble.
Hopefully this video has prepared you on what to expect when you have to go to physical therapy. Hopefully it gives you a better idea of the process, and if you have more questions, just let us know in the comment section. We'd be happy to answer up and follow up with you. So have a nice day, and we'll see you in another video. Peace.